Are you feeling overwhelmed and confused on how to create a personalized study plan as you prepare to retake the next gen NCLEX? Or maybe you're not sure what to study, how to study, or where to even start? If that sounds like you, stay tuned because in the next 20 to 30 minutes, I'm going to walk you through the step by step process that I used to develop my NCLEX study plan that worked for me and took me from feeling lost to feeling prepared. To be honest, when I decided to take my NCLEX exam, I thought that I would just consume content and build on my knowledge and boom, I would pass. But when I took my first question bank test and saw a lot of red and I received below average, I was stunned and my nerves took over. I immediately felt unprepared and worried that I would actually fail the NCLEX. I continued to consume more content and retook the question bank test and failed again. I was like, what the? I was in disbelief and panic started to set in. It was mentally draining until I sat down and revamped my plan of attack on studying for the NCLEX. It took me a little over a week to complete my study plan, but truly the hardest part was creating an effective study plan that was right and simple. So let's dive in. So, who's this message for? Now, this message can be for anyone, okay? Any nursing student, right? Really and truly, or anyone who's taking the NCLEX for the first time. However, if you are a repeat NCLEX test taker who is feeling frustrated and unsure if passing is even possible, I want to let you know that you are not alone, okay? I'm here to help you. Also, if you're struggling with preparation and questioning whether it's worth trying again, absolutely it is, and you're in the right place for the guidance and strategies to help you succeed. Now, if passing the NCLEX was so easy, why are so many nursing students and internationally educated nurses still struggling? Even though thousands of students and internationally educated nurses pass the NCLEX every year, many repeat test takers struggle because they don't have a structured, strategic approach to studying. Today, I'm going to show you the exact proven method that equipped me with the strategies that I needed to transform the time that I spent studying into a pass on the NCLEX exam on my first attempt. So you can do the same thing this time around. This is all about helping you create a study plan the right way. Now you're probably wondering, who am I and why should you trust me? And you know what? That definitely is a great question. So I'm Roxy B. I am a critical care nurse here in Toronto, Canada, and the principal nurse educator for the Nursing Code Lab. And I see you, and I hear you, and I'm here to help you. I help repeat test takers who struggle with the NCLEX go from overwhelmed and defeated to prepared and confident when they walk into that exam room. Most importantly, I'm a wifey, auntie, daughter, and sister. But my journey to get here started very differently. From 2016 to 2019, I found myself in the craziest times of my life. I transitioned from bedside nursing to a corporate leadership role at one of Canada's largest financial institutions. As well, I was trying to manage a major shift in my family dynamics. The stress and chaos led to my inability to breathe. Literally, it led to a pulmonary embolism that landed me in hospital and forced me to reevaluate my path because I was wearing busy as a badge of honor. I really thought it was a thing, but it was actually making me sick. So during my recovery, I realized that my true passion really is teaching and mentoring nurses. So after I returned back to my corporate role, I resigned shortly after that and became a nurse educator at a formal educational institution. I would get requests to help young and seasoned nurses do their resumes and provide tips on how to study for their exams. And I soon realized that students did not fail their exam because they lacked knowledge, but because they lacked effective studying and test taking strategies, plus anxiety was through the roof. That is why I'm here today to share with you what actually works. So before we dive into the step-by-step process to help you go from overwhelmed to prepared for the NCLEX this time around, I have created something super special for you, and it is my action plan for repeat test takers worksheet, which you can use as we go through this training. What you would have to do is just scan the QR code, okay, that you're seeing in the right lower hand corner. And this will take you to the site where you can download the worksheet on demand. Now, let's get you licensed so you can start your nursing career and create an impact on the people who need you the most. Now, studying for the NCLEX was definitely a challenge for me. I felt lost, overwhelmed, and unsure of what worked. That's what I want to help you avoid. You have so much to offer as a future nurse, and I truly believe that you should be a licensed practicing nurse. But I don't want you to waste any more time making the same mistakes or trying to figure it all out on your own. I've already been through that journey and I've done the hard work so you don't have to do it. Nothing brings me more joy than seeing my students succeed, earn their license, and step into their role as a nurse, helping patients during one of their most vulnerable times in their life. I know every NCLEX attempt costs you time, money, and confidence. Trust me, I get it. That's why I'm here sharing this with you. So, how can I help you take the next step towards becoming a licensed nurse and make a real difference? So, in the next 20 minutes, I'm going to show you how to create a personalized study plan and how you can do it without cramming in more information or content, and also without continuously feeling overwhelmed, because none of these are necessary. But there are a couple of things that you need to do first, so let's get into it. So my question to you is, where do you stand right now? So before creating a study plan, you need to figure out where you stand right now. Being too general in terms of what you need to focus on is just going to leave you still confused. So you need to narrow down exactly what you need to focus on. Because if you're too broad, that makes you confused and makes you feel overwhelmed. But if you get very specific, it allows you to be focused and it allows you to be successful. The old way was to go through each body system and memorize the content. Now, don't get me wrong, having knowledge about the normal functioning of a body system and the various conditions and diseases associated with that body system and its pathophysiology is important. However, having the ability to recall is not the only component, because the NCLEX is more about application and analysis versus recall. Instead, it is incredibly important to get very specific in the areas of your weakness and to be honest with yourself. This will be very specific to you. When you do this, your study plan will be your personalized roadmap on being successful on the NCLEX. It will be your secret sauce. Now, I challenge you to think about how you can make the following statement. I went from feeling overwhelmed to feeling prepared and confident when I walked into that exam room. I want you to keep that statement at the forefront as you build your study plan. To achieve this statement, the process is going to look different for every one of you and is going to allow you to remove all the fluff you currently are hearing and nail down what you need to be focused on as you study for your exam. Thinking of this statement as it relates to you will be your golden buzzer. Now, I would like you to answer the following questions or to think about it, right? Now, I need you to look back and reflect on why you failed, okay? Starting with this step allows you to create a personalized study plan that is unique to you. Think about these few questions as it relates to you. So if you are a repeat NCLEX test taker, you should have your CPR or your candidate performance report. Have a look at it and ask yourself, what areas did I score near or above the passing standard? So this here is just an example of mine that I did with Archer Review. And here you can actually see that the area that I needed to work on was management of care because I received near passing standards there. Okay? So you want to look at yours, like your real one that you had from the NCLEX exam, and look for the ones that, or the areas that had below or near passing standard. Now, whether you are a repeat test taker or a first timer, it's going to be important for you to complete a diagnostic test using your NCLEX question bank. Okay? Aim for 50 to 100 questions and look at the areas that were identified as your weak points. Okay? So this here is mine. So any area that is red, so this is the Archer review one. So any area that is red, you know that that is the area that you need to work on. So for mine, one of it was the leadership and management regarding prioritization. Now, this is like a 20-page document, so I don't have the entire thing here, but I just want to show you an example of what it will look like. Okay? So go back and look at the areas that you need to focus on. Then I encourage you to reflect on your study methods. So what actually worked for you? What didn't? Did I focus too much on content without actually doing any practice questions? And if you don't do any practice questions, forget about looking at any further content and just focus on the practice questions, because at least the practice questions will get you familiarized with the NCLEX structure and what kind of questions you may be presented with. Now, also look back as to what your struggles were. Were you struggling with content or maybe test taking strategies or both? And determine if you have a pattern of making the same mistakes, right? So are you always second guessing yourself? Are you struggling with prioritization questions, which is pretty much majority of the NCLEX, right? Are you running out of time? Assess your test anxiety level and your stamina. Did your nerves affect your performance? Did you struggle with time management? I truly believe that everyone can be successful on their NCLEX if they review the right way. If you are not sure where to start, I have experience with helping people identify the areas that they need to focus on. It is the first step we do during my one-to-one strategy sessions with students. So you can book a strategy call with me by scanning the QR code that you see in the right lower hand corner here. And then we can jump on a call and we'll uncover what's holding you back and exploring ways to keep you on track. The value of this call is going to really allow you to cut through all the information to focus on the areas that you struggle with. When you are studying for the NCLEX, you cannot go through trying to remember everything. That is impossible, right? Plus, it's not what the boards expect of you. They want to know that you can provide safe care to your patients by applying and analyzing the situation. Now that you understand where you are struggling, it's time to study smarter and not harder. So the first thing or the next thing that I would encourage you to do is to set a date for your next NCLEX attempt as soon as possible. If you delay this, it's going to cause you to lose momentum. So book it right now, even if you have to stop the video to go book it, right? But book it right now, okay? Follow your structured study plan that you're going to develop. Stay consistent and disciplined, and then also track your progress. Monitor your practice test scores and adjust the study plan accordingly, right? Believe in yourself, because if you don't believe in yourself, nobody's going to believe in you, okay? Now, the study plan must also fit your lifestyle for it to be effective as well. So now that you have set the date of when you're going to write your next NCLEX exam, this is now where you know how many weeks you have to study. If you don't have much time before your exam, you may need to increase the number of hours you spend studying each day. You may need to study in shorter, high-intensity sessions, so like 1 to 2 hours per block, to avoid burnout. But if you do have 4 to 6 weeks, which is generally typical, study 4 to 5 hours a day. If you have 8 to 12 weeks, study 2 to 3 hours per day. Try to keep the time you study consistent. This way, you will not have to put too much effort into remembering because it will become a habit over the next few weeks. Remember again to consider your other commitments and to be realistic with your study plan. So, step number 3 is to build the smarter study plan. So, instead of just rereading notes and scheduling, okay, I'm going to do cardiovascular, okay, I'm going to do renal, I'm going to do endocrine, I'm going to do GI. So, instead of like blocking off time to review every single system, okay, in great detail, and rereading your notes and watching random videos, structure your study time strategically, okay? And we're going to use the formula, the 80-20 formula, okay, or rule. So 80% of your time will focus on weak areas and test-taking practices, and then 20% of your time will be to review stronger areas and strategic practice. So this here is an example of a 4-week study plan that we developed at the Nursing Code Lab for a student. And this student during week 1, their main focus was fundamentals, pharmacology, med-surg, specifically cardiorespiratory endocrine. Plus, we encouraged them to practice answering questions, so at least 50 to 75 questions each day. And then at the end of the week to do a full-length test. Week 2 was more so about med-surg again, but neuro specific, and then peds and maternity, and then mental health, and then some prioritization, plus also to practice answering questions. But instead of just 70 up to 75, we encourage them to do 100 per day, and then at the end of the week to do a full-length test. Week 3 now, this is where, yes, the student continued with prioritization because it's quite heavy on the exam, but they also focused mainly on full-length comprehensive practice tests that were timed, and we encouraged them to review the rationales as well. Week 4, now this week is your light week. We do not want students to be cramming during this week. It's your light week. It's a time for you to develop any anxiety reduction techniques that you need to develop. Stay calm that week, no cramming, no studying specifically the day before the exam. And we also want you to trust that you are prepared by this time. Now, step 4 is to use the right study techniques. So like I mentioned earlier, studying for NCLEX isn't just about reading notes. Here's what actually works. So you have your active learning strategies. So we would like you to complete at least 50 to 100 questions daily. And the general rule is that you would complete over 1,500 questions by the time you actually sit down to write the exam. Also read the rationales as you are answering the questions so it can make sense to you. And then I always encourage my students to tell a story. So basically the teach back method. So tell a story to yourself maybe about that particular concept. If it's easier for you, tell it to a friend if you have someone who will listen to what you have to say and see if it makes sense to that friend, if that friend can then reiterate it back to you. Or you can record yourself and listen to yourself and see if it makes sense. If you're a visual person like me, mind maps and flashcards are really, really great if the topic is tricky, okay? And because I'm visual, and when I sit down to do an exam, I visualize what I learned, mind maps and flashcards work for me. And then when we talk about test-taking strategies, even if you know the content, poor test-taking strategies can cost you points. You can avoid common mistakes by making sure to read the question before looking at the answer choices. Identify keywords like first, best, priority, and those are just a few of them. And we are actually working on developing a keyword masterclass for you, so stay tuned for that. Eliminate wrong answers strategically, right? Simulate the NCLEX test-taking environment. So do a full-length NCLEX test, practice test, and set a timer, okay? So really simulate that environment so you're not shocked on that day. You also want to track your progress and adjust accordingly. The best NCLEX study plan is flexible, and you want to assess your progress on a weekly basis. So you want to ask yourself, am I improving on weaker subjects? Are my question bank scores increasing? If they're not, what am I really struggling with here? Do I need to spend more time on difficult topics? Do I need to review the rationales in depth? Do I maybe just need to take a break if I'm feeling burnt out, right? So instead of doing like 4 to 5 um, studying hours a day, you may want to break up those hours. So you may want to do 2 hours in the morning, 2 hours at night, that kind of stuff, right? It really depends on how long you have. Now, step number 6 is to manage your test anxiety and boost your confidence. Many nursing students struggle with anxiety and lack of preparation, which can hinder their performance on the NCLEX. Even the most prepared test takers can fail due to test anxiety. So, I've developed a few steps here, or a few practices that you can do. And one of it is practice deep breathing exercises to stay calm. Number 2 is to use positive affirmations and believe it. Okay? You cannot do positive affirmations and not believe it. It's not going to work. So you have to do it, do the positive affirmations and believe what you're saying. So, for example, you can say, I'm prepared and I will pass my NCLEX. Take this and post it on your bathroom mirror so every time you wake up, you see it. Maybe put it as a screensaver on your phone so every time you access your phone, you see it, right? Also, you can create a test day routine to reduce last minute stress. Do not be rushing on in the morning or whenever you're writing your exam. Don't be rushing on that day to get things organized, right? So, if you need to put your things away the night before, then do that, okay? And the other thing too is when you are booking your test, I forgot to mention this. When you're booking your test, if you are not a morning person, do not book your test for in the morning. Book your test for in the afternoon, and vice versa. If you find that you get tired later in the evening and you're not as clear, but you're clearer in the morning, then book your test during the day. Okay? Also, visualize success. So, picture yourself answering questions with confidence and receiving your passing results, and get enough sleep, right? The, the last thing you need to do is to write a test when you are sleepy, okay? So, get enough sleep. Make sure you eat if that is your routine. So, for me, I normally don't eat before an exam, and avoid cramming, okay? Now, by following this step by step process on creating a personalized NCLEX prep plan, you will go from overwhelmed to prepared and confident. If you need help with a customized prep plan now, what are you waiting for? We can do this together. So, book a 1-to-1 strategy call with me today by clicking on the QR code in the right lower hand corner here. And we can jump on a call and uncover what's holding you back so you can overcome it once and for all, and break down the NCLEX questions using a proven framework that I developed that increases your chances of answering correctly, and also to explore personalized support to help you stay on track, stay confident, and finally pass the NCLEX. Okay? Please don't let your dream of becoming a licensed nurse slip away. This is your moment, and I'm here to help you. Okay? I want to see you succeed, and I know you will succeed. All right? So until next time, love you and peace out.